Welcome, everyone. I'm Emily Haugen, a student in the Emerging Media Department, and on behalf of the College of Arts and Sciences, I would like to welcome you all to this year's second Teaching Tuesday. The theme for this spring session is disrupting pandemics, both biological like the coronavirus, but also societal like mass incarceration and other inequities of our world. We will continue to explore this theme and others this spring and next year, adapting to the need for social distancing as we go. We will begin today with an expert presentation, followed by interdisciplinary commentary, and ending with a live question and answer session. Please feel free to use the Q&A button at the bottom of the Zoom screen at any time to send in your questions. I will read them aloud to our panelists during the end portion. Today's presentation is by Dr. Amy Levad, Associate Professor in the Theology Department. Levad teaches courses related to theology and criminal justice, environmental theology, and theological ethics. She's worked extensively in prison education and restorative justice, and her current work explores Christian responses to mass incarceration. Her talk today is titled Incarceration and COVID-19, a Collision of Epidemics. Our first commentary will be by Dr. Jessica Hodge from the Department of Justice and Society Studies, and then we'll have comments from Dr. Roberta Aspalm from the School of Social Work.
My name is Amy Levad, and I teach in the theology department. I'm a Christian moral theologian, and my main areas of research are on the social ethics of criminal justice and mass incarceration. I've been asked to share some of the realities of mass incarceration during a pandemic. What follows cannot fully capture these realities, so I humbly offer a small glimpse. So much more can be said and needs to be said, and I look forward to hearing from the other panelists, Dr. Roberta Aspalm and Dr. Jessica Hodge. We're seeing a collision of two epidemics, COVID-19 and mass incarceration, and the results are disastrous. For most of us, the realities of COVID are near to our experience. It affects everything we do every day, from where we are choosing to live, with whom we eat, how we connect to our friends and families, how we go about our work, and where we spend our time. Many of us have become ill, and all of us know someone who's become ill. Unfortunately, many of us know people who've died. But we also know that not everyone bears the burden of COVID equally. COVID and our individual, communal, and social responses to it have laid bare and exacerbated structural injustices and the weaknesses of many of our systems and institutions. Before COVID, too many people had tenuous access to healthcare. Now, disparities in access are more obvious as the populations that are most vulnerable to the virus are the least likely to be able to receive vaccines and other medical necessities. Before COVID, we confronted an opportunity gap in our educational systems. Now, the need for distance and hybrid learning has made those gaps both wider and more apparent. Before COVID, families struggled with the demands of child rearing and work in a society that places responsibility for children almost exclusively on nuclear family units. Now, as parents have struggled with how to school their children and work full-time jobs, the lie of work-life balance and the impossible demands placed on families even in ordinary times have been exposed. With all of these systems and institutions, people of color, non-citizens, women, and people living in poverty are most likely to suffer. The burdens of social and structural failure are not evenly distributed. It's not that these problems didn't exist before COVID, it's that they are so obvious now with the new level of precarity introduced by the threat of a deadly virus. Among the social injustices that COVID has exacerbated is mass incarceration, although the problems in our nation's prisons and jails may not be so readily apparent as those in families, schools, healthcare systems, and other institutions. Prisons and jails are designed to hide people away. And so the added struggles and challenges of being incarcerated during a pandemic are not so readily understood. Before diving into the intersection of mass incarceration and COVID, let's pause to define terms. For details about COVID, refer to Dr. Jill Mansky's previous Teach-In Tuesday presentation, which is available online through the College of Arts and Sciences. Many people may not be familiar with mass incarceration. For a more detailed discussion, see my presentation in the Becoming Human series on the Theology Department webpage. In brief, Mass incarceration describes a unique condition of U.S. society in the late 20th and early 21st century, in which we lock up a vast population in our jails and prisons, as well as place large numbers of people under penal supervision through probation and parole. Our rates of incarceration and numbers of people caught up in criminal justice systems are unprecedented historically and unique internationally. Although we have about 5% of the global population in the United States, we hold about a quarter of the world's population. We currently have more than 2.2 million people in our jails and prisons, with an additional 4.5 million people on probation and parole. These numbers do not convey the full scope of this issue. While on any given day there are about 630,000 people in jail, in a given year there are about 10.6 million unique jail admissions, with many people having relatively short stints from a night to a year, contributing to a jail population that the Prison Policy Initiative describes as a constant churn. And all of the people in prisons and jails have connections to people outside. 113 million adults in the US, roughly a third of the population, has had an immediate family member, parent, sibling, or child in prison or jail. Sociologist Louis Quicquant has aptly described the United States today as a prison society rather than a society with prisons, because the scope of incarceration is so wide here that it affects almost everything in our society, even if we don't notice how. Of course, the impacts of mass incarceration, like those of COVID, are not evenly distributed. People of color, non-citizens, people living in poverty, and increasingly women are much more likely to bear the burdens of mass incarceration. So what happens when mass incarceration and COVID collide? Let me say now that I will not be able to touch on all of the consequences of this collision. I hope to provide a sketch so that the realities of people hidden away can be seen in the light. We'll begin by remembering the humanity of people who are incarcerated. I'll then provide information about how mass incarceration contributes to the spread of coronavirus, both inside and outside of penal institutions. I will conclude with suggestions about what can be done. If you'd like additional information, please feel free to contact me for resources. Let's begin with a human reality. It can be easy to dehumanize people who are incarcerated. Prisons and jails are built to divide us from them, and with that division is a message that they aren't part of us anymore. Rooted in a recognition that every human being bears the image of God and that human dignity is inalienable, let's begin with a reminder that people in prison and jail are people, human persons. A local organization, We Are All Criminals, helps those of us who are not and have not been incarcerated to remember this reality. Key to its mission is the acknowledgement that although 1 in 4 of us has a criminal record, 4 in 4 of us has a criminal history. We have all violated one law or another, but only some pay the consequences with time in jail or prison. We often make a them out of people in prison based on an unmerited sense of moral superiority. We need to remember that we are also human persons, which means that we, the proverbial us, make mistakes too. Sin, as theologian Reinhold Niebuhr said, is the only empirically verifiable Christian doctrine. While acknowledging our own fallibility, we must also see that people in prison and jail are more than the worst thing they have ever done. And We Are All Criminals helps us see this through Scene, a prison portrait and poetry project. From early days in the pandemic, they were able to capture experiences of men in Minnesota prisons confronting COVID. Now take a moment and think back to March and April 2020. What were the unknowns and uncertainties that kept you awake and in fear? Now imagine that your information is entirely mediated by people who have authority over your body and who may not have your best interests as a priority. You may be able to get some information from news, but not always. You may be able to get some information from friends or family members, but they can no longer visit you, and a collect phone call may cost an exorbitant amount of money. You are also surrounded by other people who have at best partial information. Your avenues for self-advocacy are limited, and your resources are for even the simplest protections: face masks, soap, hot water, hand sanitizer, distance from other people, are non-existent. Healthcare is prohibitively expensive, and the healthcare available to you has often proven, at best, indifferent to your well-being and health. Social distancing is impossible. Imagine your terror. One participant in scene, Cerise, describes his feelings. Cerise fled from Cambodia's Khmer Rouge as a child and became a refugee who resettled to the United States after several years in camps in Thailand and the Philippines. He draws an analogy between his experiences as a refugee and as a prisoner in Minnesota during the pandemic. He says, "When the Khmer Rouge came, I was 13 and at school. My family fled their home but couldn't find me. I was lost. But even in this moment, my dad risked his life to return home to unlatch the gate that kept our hogs penned in. He knew the pigs would die if they were locked in the cage, and he wasn't there to feed them, to care for them. I wonder, with COVID coming into the prisons like the Khmer Rouge, will we be forgotten in our pens? Who will remember the prisoners in a time like this?" Other people in our prisons and jails had similar experiences: fear of the disease, fear of abandonment and isolation, actual abandonment and isolation, suspicion that they would be forgotten by the rest of us and then actually being forgotten, recognition that others might treat them little better than pigs, and then actually being treated as less than human. As we consider the collision of COVID and mass incarceration, commitment to uphold the dignity of every human person requires our acknowledgement of the humanity of people in prison and jail, as well as recognition of the moral demands this commitment places on us and our society. So, how many people in U.S. jails and prisons have contracted COVID-19, and how many have died? These questions are difficult to answer. First, the numbers grow daily, just as they do for the general population. Second, flaws with data reporting for the general population also affect data reporting for the incarcerated. Third, federal, state, and local carceral facilities have different practices for reporting, and the differences make it difficult to compare and compile information across various jurisdictions. Fourth, because jail populations are more transient than prison populations, and the incubation period of COVID can make it difficult to know exactly when a person was exposed to the virus, it's hard to know how many people in our jails have contracted COVID while incarcerated. We have better information about prisons, but it's still limited. Let's focus on prisons, recognizing the challenges here of seeing the whole picture. As of my writing in late February, the Marshall Project, in partnership with the Associated Press, found that at least 381,462 people in prison had tested positive for coronavirus since the beginning of the pandemic. Note, that's tested positive. Many more have probably had COVID but not had access to testing. Mass testing of people in prisons in states such as Michigan, Ohio, and Tennessee suggests that coronavirus had been circulating among people without symptoms in much greater numbers than previously known. That is, our case counts are way too low if we're only counting people who tested positive. At a minimum, a quarter of the people in U.S. prisons have had or currently have COVID versus approximately 8 to 9% in the general population of the United States. The first known incarcerated person to die of COVID in the United States was Anthony Cheek in Lee State Prison in Georgia on March 26, 2020. Since Cheek died, an additional 2,418 people in prison have died. Again, these numbers only account for people in prisons, not jails. A full account of the extent of infection tied to mass incarceration also needs to attend to the communities in which prisons and jails are located. One aspect of the lie that people in prison and jail are them in opposition to the us who aren't incarcerated is the idea that there are firm and impassable boundaries at the razor wire between us and them. However, as the Prison Policy Initiative observes, the boundaries between life inside and surrounding communities are actually quite porous, with staff, vendors, volunteers, and visitors constantly flowing in and out of correctional facilities, not to mention the frequent turnover and transfers of incarcerated people themselves. In principle, we ought to be concerned about transmission of coronavirus in prisons and jails because the people housed in them are human persons bearing inalienable dignity. We ought also to be concerned because coronavirus spread in prisons and jails will inevitably lead to coronavirus spread outside these facilities because of the porous boundary between prisons, jails, and the wider community. According to a December 2020 report by the Prison Policy Initiative, mass incarceration has contributed significantly to the spread of coronavirus outside of prisons and jails. Over the summer of 2020, COVID caseloads grew more quickly in non-metro counties with more people incarcerated. In addition, caseloads grew much more quickly in the same time period in counties in multi-county economic areas, such as the Twin Cities, Atlanta, Denver, or the Bay Area, with more people incarcerated. That is, if your area had more incarcerated people, your area also saw more coronavirus transmission, regardless of whether you lived in a rural or urban context. On a national level, mass incarceration added more than 500,000 COVID cases among people outside prisons and jails in the 3 months of the summer of 2020. With some facilities, community transmission outside prisons and jails has been so high that the facilities can no longer be staffed adequately. Those facilities have closed and the people incarcerated in them transferred to other facilities, often without testing or quarantine, to ensure that the transfer of people would not also transfer virus, thereby contributing to spread in even more prisons, jails, and communities. There's an important lesson here. We like to think of our fates out here as separate from the fates of people who are incarcerated. Before COVID, it was often easy to believe this idea to be true. Now we must recognize that the well-being and health of all of us depends on the well-being and health of people in jails and prisons. And I hope from this pandemic, we accept that our fates are indeed bound together and begin to redeem our prison society. So what ought to be done? Action needs to be taken quickly. People in jails and prisons have higher rates than the general population of health conditions, such as asthma, tuberculosis, and diabetes, that make them more vulnerable to serious or fatal cases of COVID. Due to increasing lengths of prison sentences under mass incarceration, prison populations in the United States are also now older than they've ever been. Without immediate action, more people both inside and outside prisons and jails will die unnecessarily. But what actions? First, we need to reduce the number of people in local jails by admitting fewer people in the first place and by releasing people who are already in jails. If we reduced jail admissions by 50%, jail populations would be 25% smaller within a week. We can achieve this reduction at several points in our criminal justice systems. Police could arrest fewer people for petty offenses. Prosecutors can opt not to prosecute or to defer prosecution in many cases. And courts can vacate bench warrants for unpaid court fines and fees and for technical probation and parole violations, which involve behaviors that would not be crimes for people not on probation or parole, such as failing to report a change of address or missing a meeting with an officer. Jails can stop renting space to outside agencies such as ICE and state prisons. And legislators can expand the list of non-jailable offenses. All of these tactics would reduce the number of jail admissions. To increase the number of people released from jails, administrators can focus on releasing people nearing the end of their sentences, people who are at higher risk for severe or fatal COVID, and people who have not yet been convicted of a crime. This last group alone would include more than 500,000 people nationally. There are multiple possibilities for decarceration in state and federal prisons, also by restricting admissions and increasing releases. Reducing admissions to prisons can be accomplished by refusing to return people to prison for technical probation and parole violations. Doing this alone could reduce the number of admissions to prisons by about 60,000 people per year. To increase releases from prisons, we can begin with people who would be released soon anyway. If we were to release people whose sentences would end within the next year, we would release roughly 600,000 people. Why not release them now, when their ongoing presence in prisons contributes to higher rates of COVID transmission both inside and outside of prison? And why not extend this mercy so that people who are going to return to outside communities soon anyway don't end up dying of COVID in prison? In addition, as a society, we could focus on releasing people in minimum security facilities and on work release. People who have conditions that make them more vulnerable to severe or fatal COVID, elderly people in prisons, people who have committed minor offenses, and people who are at low risk for committing additional serious offenses. We have mechanisms to achieve these possibilities through parole boards, legislation, and judicial decisions. As people are released, they would need supports to return to community, including housing, healthcare, food, clothing, education, and employment. These supports should be part of any COVID relief bills passed on federal and state levels. Beyond these strategies, people who remain in prisons and jails need to be given the resources necessary to protect themselves from coronavirus. With fewer incarcerated people, the possibilities for social distancing within prisons and jails increase, although social distancing will remain difficult. Prisons and jails should eliminate medical copays that deter people from seeking medical care, especially when copays often dramatically exceed what someone in prison or jail can earn through work. Healthcare for people in prisons and jails is a basic human right. Staff should have paid sick leave and should be discouraged from coming to work if they are ill or have been exposed to someone who is ill, so that they are less likely to bring coronavirus into facilities. Everyone in penal settings should be required to wear face masks, and face masks should be provided to incarcerated people without cost. People in prisons and jails should have ready access to soap, hand sanitizer, and water. And people in these facilities should be among the first groups to receive vaccines. The CDC provides additional guidance that should be heeded by local, state, and federal governments. For some, the ideas of not putting so many people in jail or prison in the first place, and of letting so many people in jail or prison go, and of treating people who are incarcerated as human persons with inalienable dignity may be shocking. Wouldn't this plan threaten public safety? It's important to remember that mass incarceration came about not because of high crime rates. Furthermore, mass incarceration largely does not stem crime in our communities. Rather, mass incarceration has come to be due to tough on-crime policy decisions over the last half-century that have proven ineffective at guaranteeing public safety. And as our data about the effects of mass incarceration on the transmission of coronavirus outside of prisons indicate, people are dying now outside of prisons because we have so many people in jails and prisons. Mass incarceration itself is a threat to public safety. And here's a key point. Mass incarceration has always been a threat to public safety. Many of us just couldn't see it as clearly before this pandemic. COVID and our individual, communal, and social responses to it have laid bare and exacerbated social injustices and the weaknesses of many of our institutions. We've seen this in educational systems, healthcare, housing, employment, and families. We knew there were problems before, but they're just so clear now. And so with mass incarceration. Our immediate dilemma concerns how do we respond to this emergent situation so fewer people both inside and outside of carceral settings do not get sick and die. But we must also look to the future. What can we do now so that we need not return to the conditions of mass incarceration? If we respond justly to the collision of COVID and mass incarceration now, perhaps we can extend these solutions to dismantling mass incarceration in the days to come.
Hello, my name is Jessica Hodge, and I am a faculty member in the Department of Justice and Society Studies, where I teach primarily within the criminal justice program. I'm also the faculty director with the Center for the Common Good. I have been invited to respond to Dr. Levad's insightful discussion about the intersection of COVID and mass incarceration. As a criminologist, you may think that I will discuss how the exposure to COVID within our country's correctional facilities is an unfortunate consequence of being convicted of a crime. I mean, many of us have heard the phrase, if you do the crime, you must do the time. Well, to put simply, this could not be further from the truth. And let me tell you why. First, we have to ask ourselves, What is the purpose of incarceration? And how does this form of punishment achieve justice? If the purpose of incarceration is simply to seek retribution, in other words, if using incarceration is simply to punish an individual for past behavior and not about rehabilitation or deterrence, then perhaps justice is achieved, as we are certainly punishing individuals through the high rates of incarceration in this country. However, if we are attempting to use incarceration as a means to rehabilitate individuals so that they can reintegrate into society to become law-abiding citizens, or as a means to deter or prevent individuals from committing future crimes, then incarceration is failing to achieve any sort of justice. For instance, research shows us that incarceration is not an effective way to prevent criminal activity. Over 2/3 or 60% of people who return to the community after being incarcerated will recidivate or commit a new offense within the first 3 years after release. This is often referred to as the revolving door of the criminal justice system. One returns almost as quickly as they left. The reasons for this are complex and varied, and we don't have time to thoroughly dissect each of them. But there are some clear obstacles, or what is often referred to as collateral consequences, that we can highlight to explain the high rates of recidivism among those who have been incarcerated and reentering society. One major obstacle for a successful reentry process relates to finding employment. We expect individuals returning to the community to obtain lawful employment. This is, in fact, a standard condition of release. Unfortunately, although we are a society that currently relies on incarceration as a primary form of punishment, we are also a society that continues to brand individuals using phrases such as ex-offender and former inmate once released. The negative stereotyping and alarm often associated with these phrases significantly impacts the ability of someone to find employment during the reentry process. We also expect individuals to obtain housing once released. And as you can imagine, the ability to obtain housing is very limited if one does not have a steady income. In fact, it is estimated that formerly incarcerated people are almost 10 times more likely to be homeless than the general public. There are many other consequences to mass incarceration that we could discuss that go beyond the individual, though, including the negative impacts on families and the children of incarcerated parents. We could also discuss how prisons cost taxpayers more than $80 billion a year, and that doesn't include jails, nor does it include other items such as court costs or expenses related to policing. But perhaps one of the most glaring examples of injustice within our criminal justice system is the disproportionate impact of mass incarceration on communities of color in this country. Black, Indigenous, and people of color are more likely than white people to be arrested and charged for crimes, and they are also more likely to be convicted and sentenced to prison, even for similar types of crimes and who have similar criminal histories. This racial injustice is well documented in criminological research. Moreover, the barriers to success, as mentioned above, also disproportionately impact Black, Indigenous, and people of color. For instance, if we were to take a closer look at the research around the employment barriers for individuals returning to the community, we would see that not only does having a criminal record impact the likelihood of receiving a callback from a potential employer, but this changes significantly depending upon the race of the applicant. For example, in one study, white applicants with a criminal record were more likely to receive a callback than Black applicants without a criminal record. When putting this together with the collateral consequences of incarceration for those returning to the community, this all but ensures that Black, Indigenous, and people of color will continue to be those most likely impacted by the criminal justice system. And in the context of our discussion here, they will continue to be those most likely impacted by the devastating impacts of the pandemic. So, what can we do? Dr. Levad has offered some concrete ways in which correctional systems in this country could take action now to address the safety and healthcare needs of those currently incarcerated in this country. These actions would not only impact those currently incarcerated, they would have a positive impact on those of us in the larger community as well. As individuals, we also can be advocates for change, for both the immediate actions that are needed and for the longer-term reforms that our criminal justice system requires. For example, we can write op-ed pieces for our local newspaper to bring attention to these issues. We can write or call our local representatives to insist that they prioritize these actions. And if eligible, we can vote for elected officials, for example, our local county prosecutors, that run on agendas that include addressing and implementing significant criminal justice reforms. And finally, I encourage you to really consider what justice means to you and whether justice can truly be achieved through the current criminal justice system. Without addressing the inequities within our communities, for example, inequities related to the opportunity gap in education, inequities related to the healthcare system, as talked about in the first teach-in, or inequities related to housing and food insecurity. If we don't address these inequities in our communities, we will continue to have environments that foster and perpetuate crime. We must also address how the criminal justice system is often a tool that magnifies these inequities. And in fact, we may need to consider how our criminal justice system may not be a system of justice at all. Thank you for listening.
Hi, my name is Rob Aspalm, and I'm on faculty in the School of Social Work. My research focuses on street gangs, community violence, race, and inequality. I'd first like to thank Dr. Levad for her incredibly insightful presentation. I think her point about not losing sight of the human dignity of those languishing in jails and prisons bears particular emphasis, as do her sensible and straightforward recommendations for addressing the nexus of COVID-19 and mass incarceration. What I hope to accomplish with my remarks is to shed some light on the broader structural context that has fueled both mass incarceration over the last 4 to 5 decades, as well as the devastating impact of the COVID-19 pandemic over the last year or so. Namely, a context in which the state has largely abdicated a proactive role in ensuring people's basic well-being. The explosion of our carceral system in the US began in earnest during the 1970s and intensified over the following 3 decades before tapering off somewhat during the Obama presidency and in the years since. Why did mass incarceration materialize and flourish during this historical period? In short, mass incarceration is best understood as a strategy for managing inequality that emerged in the wake of urban deindustrialization. Beginning in the 1960s, central cities in the US collectively lost millions of manufacturing jobs, most of which were good-paying, unionized, and required relatively little formal education or skills. These jobs, which have been the bedrock of the urban working class, were eliminated via both automation and the movement of industry to places where land and labor were cheaper and more pliable: emerging suburbs, small town hinterlands, and foreign countries. Eventually, these shifts had the effect of destroying the economic base of the urban working class at the same time that whites were leaving cities for new suburban developments and blacks were arriving in cities in pursuit of the exact kinds of work opportunities that were then evaporating. As the first cohorts of baby boomers came of age in cities like Chicago, St. Louis, and Detroit in the late 1960s, the capacity of the industrial sector to absorb these workers was already diminishing, and unemployment rates among young Black men in central cities skyrocketed. Crime and violence increased alongside unemployment and poverty, and street gangs that would endure for decades, like the Gangster Disciples and Vice Lords in Chicago and the Bloods and Crips in Los Angeles, likewise exploded onto the scene during this period. US policymakers in Washington failed to pursue industrial policies that would have protected those jobs or public works programs that would have put those displaced back to work. Because of this, states and cities increasingly turned to the cheapest and most direct methods available to combat crime and violence: police, jails, and prisons. While the cost of incarcerating people is incredibly high, it is much cheaper to incarcerate a relatively small segment of society than it is to provide a dignified material existence for everyone. Indeed, mass incarceration has been fueled not only by persistent structural unemployment, but by the gutting of the welfare state over the last 4 decades or so as well. Mass incarceration, in other words, is best understood in terms of the vast inequality produced by our social order and our failure to address this inequality in a humane fashion via social policy. In fact, going in the opposite direction with the rolling back of our public sector. In this respect, mass incarceration shares many parallels with the devastation of the COVID-19 pandemic here in the US. As a pandemic disease, COVID-19 was certain to claim some victims, irrespective of the attempts of policymakers to preempt its effects. Nonetheless, as with Hurricane Katrina, the recent snowstorm in Texas, and countless other examples, the response or lack thereof from policymakers turned an inevitably bad situation into a catastrophic one. By now, we are likely familiar with many of the shortcomings of our public officials, particularly during the early months of the pandemic, including those related to travel restrictions, shelter-in-place orders, social distancing, masking requirements, and the like. But we should also be attuned to the fact that our anemic response to the pandemic was exacerbated by a number of broader, longer-standing factors, including our fragmented, market-oriented healthcare system, our meager welfare state, and the decades-long gutting of our public health sector. Indeed, some of those held up by the media as clear-eyed realists or even heroic figures during the pandemic were among the most egregious offenders in these regards. And so we have had millions of Americans who have needlessly been confined to jail and prison cells over the last half century. And we have had millions of Americans who have needlessly contracted COVID-19, hundreds of thousands of whom have unnecessarily died. In both cases, these issues have been exponentially more destructive than they otherwise would have been, owing directly to the failure of our public institutions to ensure the basic well-being of all members of our society.